healthcare issues, this was an opportunity, and it's too bad, the member from Brant didn't mention this, but like this was an opportunity, and you would have had our full support if you had negotiated a deal for eye care in Ontario, and that should have been here. We believe that eye care is healthcare. In fact, we know we have all anecdotal circumstances across in our ridings, but I will tell you that my son's good friend, his optometrist caught his brain tumor. Think of the opportunities that we are missing on this front. And the optometrists have been fairly clear, as has the member, Ms. Marteau, last week. She came out and she said, listen, she issued a statement last week calling on her party, that would be you, to abandon the hard line it has taken with the Ontario Association of Optometrists. She says she's an optometrist herself, as the member from Brant is as well, and she argued her professional colleagues are in the right. This is, she broke ranks, although there's been a lot of people that have sort of been exited out of the party, but this is an intentional breaking of the ranks and an exposing, the hardline tactics that this government has been making with optometrists. And she goes on she says their colleagues are on the right, and she poked holes in the province's justification for not yielding to the association's demand that it commit to covering the cost of OHIP eye services as a precondition to resuming negotiations. She called the government's current offer unsustainable and criticized the province for the heavy-handed tactics. So there's a whole new discourse on this tension and drawn out, tension between optometrists and the Minister of Health. And we all know, I've been getting 2, 3, sometimes 5 calls a week from parents who are concerned about their children who cannot access eye care and cannot see the board or the whiteboard in their classroom. At least we can acknowledge, we can find some common ground that this is an issue. It's an issue for seniors who can't drive. They can't get their licenses renewed. They want their independence. Seniors, just in case you don't know this, they vote. And they are mad. In fact, I have never seen so many activist seniors in Ontario. These are very different, of course, from the downtown activists who are fighting Highway 413, who actually apparently live in the Minister of Transportation's riding, and they're very upset that they've been called downtown activists. And millionaires, yes. Yeah. You can't forget the millionaires in the Minister of Transportation's riding. So this long drawn-out thing with optometrists is really, what is the game plan here? We want to know. The people of Ontario want to know. How are you going to extricate yourself from this now 239 days, Madam Speaker? And this is from the Ontario Optometrist Association of Optometrists site, and they're just putting this out there. We would like to provide you with an update on our discussions with the Ontario government. Unfortunately, since September 1st, millions of Ontarians have lost access to primary eye care services because the Ontario government continues to neglect optometry services. And here is the update. The number of days optometrists did not hear from the Ministry of Health. The Ministry of Health did not communicate with optometrists from December 5th of 2020 to August 5th of 2021. An independent third-party accounting firm, BDO, determined that the average operating cost for rent and staff and equipment to provide an eye exam in Ontario in 2019 without doctor compensation was $75.51. What does the government come back with? $48.43. So, the Minister of Health, interesting, because these things come back, right? They come back to bite you. With the pharmacists back in 2010, she said, why should the pharmacists have to pay to do the work that should be funded by the government? And, I send the same question back to the Minister of Health on this. Why should optometrists be heavily subsidizing, the OHIP-funded patients, seniors, and childcare, unless you've made a political decision that you no longer want to value eye care at all and don't see that it is a prevention piece on the healthcare file. So that level of frustration is off the charts. For some of us who were here when the Liberals were here, they always used to describe themselves as overachievers. Well, on this file, you are overachieving on an incompetence level that we haven't seen for quite some time. I mean, get back to the table. Seniors, children, vulnerable Ontarians, they need their eye exams. We need them to get access to that care. And also remember, I mean, a lot of optometrists during the pandemic never received any support from this government. I mean, so I don't know what the game plan is. Maybe you don't either, but it's going to become a huge political football. And I know that you care about your political fortunes because this document proves that. It proves that you are more concerned about your political fortunes than the very people that we serve. And so on healthcare, I'm including the repealing of Bill 124. Why it has taken so long, I have no idea, nor do the nurses. The optometrists are completely frustrated. You must be inundated. One of your own has broken ranks and revealed that there's really no strategy here, except that you want to play hardball. And I hope that the optometrists that sit on that side of the House can actually try to sway this Minister of Health to get eye care back in the healthcare realm. I mean, it's well overdue. On the issue of vaccines, I mean, I brought forward a motion to the floor of this legislature.
Good morning, Speaker. My question is for the Premier. A veteran approached me after Remembrance Day ceremonies in Guelph last Thursday. His eyesight has declined, and he desperately needs access to an optometrist, but neither he nor his grandkids can make an appointment for eye care. Speaker, it's wrong that seniors and children cannot access eye care in Ontario. It is wrong that optometrists lose over $30 for each OHIP eye exam. So, Speaker, on behalf of this veteran and thousands of people across Ontario, I'm asking the Premier, will he do basic math and cover the full operating cost of delivering an OHIP eye exam in this province?
Minister of Health.
Thank you, Speaker, and thank you to the member for the question. I can certainly agree with you that it is wrong that people are not receiving the services that they need to receive quality eye care. That includes seniors, that includes people under age 18. But the Government of Ontario is ready, willing and able to pay for these OHIP-covered services. Sadly, the Ontario Association of Optometrists is not. Now, I think it's very important that anybody who needs eye care should know that the College of Optometrists requires the optometrist, even if they are not providing the care themselves, for someone that needs urgently required health care, the college says that the optometrist must refer them to someone who will provide that service. That is important for everybody to know, to first discuss it with your optometrist and then get a referral to somebody who can help you. However, I think it's also important to say that we are ready, willing and able to sit back at the table at mediation with the association. We've asked them to do so several times. We've made a $39 million payment into their accounts already. We're ready to increase their fees by 8.4%, retroactive to April 1st, and we are ready to sit down and have a working table today, if they're willing to go back to the table, to talk about their overhead costs. We know that they have been put back by previous governments. We want to make it right with optometrists. We want them to come back to the table so that we can continue to provide those services.
Thank you very much. Thank you very much. The supplementary question.
Speaker, with all due respect to the minister, I ran a small business for many years. You cannot have your business continue if you're losing money on each exam. So yes, the government says they will continue to pay OHIP eye exams, but if you're losing $30 every time you give an exam, how can you continue to do that? The government says we've offered an 8% increase. So that means instead of losing $30, they're losing around $27. It's still not sustainable. And the minister says the government is willing to negotiate. I say it in the House, I said it on social media. So it's my understanding that the OA president has provided the minister through a letter his cell number to begin negotiations. So my question to the minister would be, can the minister inform this House and the people of Ontario how many formal outreaches have been made to the OAA through a letter or a phone call asking them to come to the negotiating table since September 1st when services were withdrawn?
Thank you. And to reply, the Minister of Health.
Thank you very much. I would say the answer is many. As I mentioned in the letter that I received from the Leader of the Official Opposition and the President of the OAO, they asked me, in my capacity as Minister, that you direct the Ministry of Health to immediately commence intensive negotiations with the OAO concerning OHIP optometry fees. Further, the negotiation process must include a mediation and fact-finding process that results in a public report in the event that the parties are unable to reach an agreement. We said yes. We honoured the OAO's request to commence mediation only to have the OAO reject the mediator's terms and walk away from the table. The Ministry of Health has agreed to the conditions required by the mediator to resume negotiations and is ready, willing and able to continue those discussions with the OAO. But I would say that given the OAO's engagement of legal counsel to support their negotiations and the mediator's regular outreach to Council to explore the continuation of our talks, the OAO is very well aware.
Thank you very much. The next question, member statements. The member for Spadina-Fort York.
Thank you, Mr. Speaker. November 14th was World Diabetes Day, marking 100 years since Banting and Best discovered insulin in a lab just a few hundred meters from this legislature at the University of Toronto. But as well as insulin, people with diabetes often need eye care. Jacob Wolf lives in Spadina-Fort York and has type 1 diabetes and has been unable to update his prescription because this government refuses to negotiate a fair deal, leaving optometrists paying an average $27 out of pocket to examine an OHIP-insured patient. It has been 76 days since seniors and children have been able to receive OHIP-covered eye exams. My constituents have sent hundreds of emails and have thousands of signed petitions asking the government to negotiate in good faith with optometrists. There are people like Dr. Melissa Yoon of Dr. Yoon Optometry in Spadina-Fort York who simply wants to assist her clients and can't keep paying out of pocket for it. The impact is far-reaching, affecting people from the ages of 7 to 70. Bob Whalen is 70 years old and a constituent, and he can barely read because he needs a new prescription. Another constituent, Jugbeer, has a 7-year-old daughter who needs prescription glasses but hasn't been able to get an eye exam because of this government's refusal to negotiate. He says that this is having a negative impact on her learning and her well-being. Mr. Speaker, we are imploring this government to negotiate a fair deal with optometrists so that residents like Jacob, Bob and Jugbeer's daughter can get the eye care that they need.
Next question, the member for University Rosedale.
Thank you, Speaker. My question is to the Minister of Health. For 4 months now, seniors and kids have not had access to OHIP-covered eye care in Ontario. Seniors like David Allgood, a resident in my riding of University Rosedale. In October, David's regular eye exam was cancelled because the Ford government refused to negotiate with optometrists. Just a few days later, David started experiencing vision problems, which impacted his ability to read, write and drive. David pleaded with his optometrist for a visit but was declined and was referred to the emergency room. David is angry that the Ford government put his eyesight at risk, and he's angry the government is promoting unnecessary and costly visits to the ER. This is my question. Why is the government further burdening hospital emergency rooms when they could just pay optometrists a fair price for their services?
Minister of Health.
Speaker, and thank you very much to the member for the question because it gives me the opportunity to correct some inaccuracies that are out there right now. First is that the Government of Ontario has never refused to pay OHIP services for children and for seniors. We are ready, willing and able to provide those services, but the fact of the matter is that the Ontario Association of Optometrists is not prepared to do so. We went to the table with them to meet for mediation. They disagreed with some of the ways to proceed, but we decided to move ahead in any event. And we did receive a letter that asked why we weren't providing the services. The answer is we are ready to. We are urging the Ontario Association of Optometrists to come back to the table. We want to reach a deal with them. We know they've been treated badly by other governments.
Response?
We want to fix that, and I'll speak in my supplemental about what we are prepared to do.
The supplementary question.
Thank you. Back to the Minister of Health. David later learned he had a hole in his retina which, left untreated, could cause permanent blindness. And David is just one of the thousands of people in Ontario who've had their eyesight put at risk because of this government's failure to negotiate in good faith. For decades now, successive governments have failed to increase OHIP funding to cover the cost of basic services like eye exams for children and seniors. And we knew this situation was coming and it could have been prevented. In fact, I sent a letter to the Minister of Health over a year ago urging the minister to engage in dialogue with optometrists so service wouldn't be restricted. This is my question. When will this government stop putting Ontarians' health and eyesight at risk and return to the negotiating table to reach a fair deal?
Minister of Health.
Thank you. In fact, we take the health and well-being of every single Ontarian to be very important, and we are prepared to sit down at the table with the Ontario Association of Optometrists. We've already paid, because of the fact that they haven't had an agreement since 2011, we've already paid $39 million into their accounts to cover what they would have received had they been paid at the same rate of physicians for the last decade. That is what the association asked for. We also agreed to go into mediation with them, which is what the association asked for. We agreed to the mediator that they asked for. We also have agreed that we would pay to start 8.48% increase going forward, but retroactive to April 1st, recognizing again that they wanted to be paid at the same level that physicians would have been paid. And we are prepared to set up a working group to discuss the issues with respect to overhead that the association has asked us to do. We are ready to do that today if the Ontario Association of Optometrists will come back to the table. That's all we're asking them to do, and we're ready to go.
We've all been talking a lot about eye care in this House, right? I wish we didn't have to, but it is mind-boggling. People in this province are going right now without needed medical care, and yes, it is medical care, because this government will not negotiate in good faith with optometrists. We learn now that two members, I think we've learned this week, two members of the Conservative caucus have raised these issues and their concerns with the caucus. Well, good for them. Good for them. Why isn't your caucus listening? I mean, we've been talking today about, are we going to have to find more space on this side of the House again? I don't know, Mr. Speaker, because I got to tell you, I'm a little worried about anybody over there raising issues with their caucus. It is day 77 of services being withheld, and children and seniors in this province are the ones paying the price. We know it was underfunded for decades under the previous Liberal government, but that is not a reason to continue that. You are in government now. Fix this. That's right. That's right. Now, on the top.
The next question, start the clock. Member for Ottawa South.
Thank you very much, Speaker. My question is for the Premier. In March 2018, the Ministry of Health mandated public health units to provide school-age children with vision screening. And this was a really important move and something I've advocated for many years because, simply put, vision is such a huge part of our children's learning and development. The challenge now, though, is they can get screened, but they can't go to an optometrist to get the help that they need, to get the glasses they need. So, Speaker, through you, will the Premier get his government back to the table and resolve the stalemate with Ontario's optometrists?
The Deputy Premier and Minister of Health.
Speaker, and thank you very much to the member opposite for the question. Our government continues to be very disappointed that optometrists continue to withhold publicly funded services for youth and seniors while also declining to come back to continue negotiations. Our government has continued to fund OHIP services for seniors and youth, and there's no reason why the optometrists can't continue to provide services while we continue to negotiate. It was the optometrist that wrote to me as Minister of Health and asked, I quote, that you direct the Ministry of Health to immediately commence intensive negotiations with the OAO concerning OHIP optometry fees. Further, the negotiation process must include a mediation and fact-finding process that results in a public report in the event that the parties are unable to reach an agreement. We said yes to that. We also said yes when the association asked for a mediator to be involved. We also said yes to their choice of mediator,
Response.
who's a very accomplished and experienced individual. But then, Speaker, the OAO rejected the mediator's terms and walked away from the table. It's now—
Thank you very much. The supplementary question.
Thank you, Speaker. Well, the people who are most disappointed are parents and seniors. So, Speaker, Ontario's vision screening program actually came out of a lot of work with Ontario's optometrists. I know this. And their I See, I Learn program was designed to make sure that children who needed glasses would have them, despite whatever their family's income was. And I know they care about their patients, and I know they really care about kids. So what the government is offering optometrists, it's just not reasonable. So lawyers or doctors, engineers, small business owners would not accept these kind of losses. So what Ontario's children and seniors need from this government is for them to come back to the table with a fair and reasonable offer now, so that they can get back to be able to live and to learn. This has gone on way too long. So, Speaker, will the minister commit to doing this?
Minister of Health.
Thank you very much. The Ministry of Health and myself as Minister have always been ready and willing to go back to the table with the mediator to try and resolve some of these issues that have been outstanding with respect since the previous agreement expired under the Liberal government in 2011. We know that they have suffered losses. We want to negotiate with them. We want children and seniors to be able to receive the eye care that they deserve. So what we're asking, and the Ontario Association of Optometrists knows very well, because the mediator reaches out on a weekly basis to the Ministry of Health and to the association to invite us to come back to the table. So the association knows very well what is necessary to do in order to do that. The Ministry of Health is ready to do that. We ask the optometrists to come back to the table because I certainly agree with you that children and seniors deserve far better.
Thank you. The next question. I recognize the member for Ottawa Centre.
Well, thank you, Speaker. It's an honour to rise this morning, and I'm thinking of a Paralympian back home, Kevin Frost, who recently did an interview on the CBC Radio morning news program. And Kevin has represented our country at a high level in Paralympic sport, but he's at his wit's end right now, Speaker, because he can't get access to optometric care. And what he is saying plaintively to this government is that for every day we don't have an agreement with optometrists in this province, we are depriving him his ability to move in our city, to access the things he needs, to get around, to move around. We're implicitly telling him, go to another province, go to another country maybe, to get your optometric needs met. And I just want us to reckon with the fact that Kevin's not alone. We have people with disabilities and seniors and kids urgently needing optometric care who aren't getting it. In the same radio program, Speaker, a member of this government, MPP Martow, spoke. And when she was asked and told what the government had said, that it's trying to negotiate in faith and they're waiting for the optometrists to come back to the table, MPP Martow said, you know what, that's not true. The fact of the matter is, when the optometrists went to the table and they opened up the Zoom screen, they saw a blue screen with nobody on it. So, Speaker, as Kevin and others reckon with how to resolve this mess, can we just please get back to the table? Because people with disabilities, kids, seniors, they deserve optometric care, and they need it now.
The member for London West.
Thank you very much, Speaker. I have a petition signed by hundreds of London West seniors and families who depend on their local optometrist for high-quality eye care, and I'd like to thank the offices of Dr. Alan Bernardi, Dr. Greg Cook, Old South Optometry, Byron Optometry, and FYI Doctors for sending in these petitions. The petitions read, to the Legislative Assembly of Ontario, whereas the Ontario government has underfunded optometric eye care for 30 years, and whereas the government only pays an average of $44.65 for an OHIP-insured visit, the lowest rate in Canada, and whereas optometrists are being forced to pay substantially out of their own pocket to provide over 400 million services each year to Ontarians under OHIP, and whereas optometrists had never been given a formal negotiation process with the government, and whereas the government's continued neglect resulted in 96% of Ontario optometrists voting to withdraw OHIP services beginning September 1st, 2021, we, the undersigned, petition the Legislative Assembly of Ontario as follows: to instruct the Ontario government to immediately commit to legally binding formal negotiations to ensure any future OHIP-insured optometry services are, at a minimum, funded at the cost of delivery. I support this petition, affix my signature, and will give it to Page Isabella to take to the table.
Thank you. Petitions, the member for Brampton Centre.
Thank you, Speaker, and I'm honoured to present this petition to save eye care in Ontario. And I'd like to thank Dr. David Bookman at the Vaudin Medical Centre and patients at the clinic for bringing this petition to our office, to the Legislative Assembly of Ontario. Whereas the Ontario government has underfunded optometric eye care for 30 years, and whereas the government only pays an average of $44.65 for an OHIP-insured visit, the lowest rate in Canada, and whereas optometrists are being forced to pay substantially out of their own pocket to provide over 4 million services each year to Ontarians under OHIP. And whereas optometrists have never been given a formal negotiation process with the government, and whereas the government's continued neglect resulted in 96% of Ontario optometrists voting to withdraw OHIP services beginning September 1st, 2021, we, the undersigned, petition the Legislative Assembly of Ontario as follows: to instruct the Ontario government to immediately commit to legally binding formal negotiations to ensure any future OHIP-insured optometry services are, at a minimum, funded at the cost of delivery. I am happy to add my name to this and send it off with Paige Joel.
I have today a petition to save eye care in Ontario. It reads, to the Legislative Assembly of Ontario, whereas the Ontario government has underfunded optometric eye care for 30 years, and whereas the government only pays an average of $44.65 for an OHIP-insured visit, the lowest rate in Canada, and whereas optometrists are being forced to pay substantially out of their own pocket to provide over 4 million services each year to Ontarians under OHIP, and whereas optometrists have never been given a formal negotiation process with the government, and whereas the government's continued neglect resulted in 96% of Ontario optometrists voting to withdraw OHIP services beginning September 1st, 2021, we, the undersigned, petition the Legislative Assembly as follows: to instruct the Ontario government to immediately commit to legally binding formal negotiations to ensure any future OHIP-insured optometry services are, at a minimum, funded at the cost of delivery. I'm happy to sign this petition, Speaker, and send it with Clerk Isabella to the table. Page Isabella to the table.
Member for Davenport.
Thank you, Mr. Speaker, and I'm pleased to present this petition on behalf of the thousands of residents of my riding who have signed the petition and written to me about this issue. It reads as follows: petition to save eye care in Ontario. To the Legislative Assembly of Ontario, whereas the Ontario government has underfunded optometric eye care for 30 years, and whereas the government only pays on average $44.65 for an OHIP-insured visit, the lowest rate in Canada, and whereas optometrists are being forced to pay substantially out of their own pocket to provide over 4 million services each year to Ontarians under OHIP, and whereas optometrists have never been given a formal negotiation process with the government, and whereas the government's continued neglect resulted in 96% of Ontario optometrists voting to withdraw OHIP services beginning September 1st, 2021, we, the undersigned, petition the Legislative Assembly of Ontario as follows: to instruct the Ontario government to immediately commit to legally binding formal negotiations to ensure any future OHIP-insured optometry services are, at a minimum, funded at the cost of delivery. I could not agree more with this petition, and I'm pleased to affix my signature and hand it over to Clerk Joel. Thank you. Page Joel.
Petitions, the member for Spadina, Fort York.
Thank you, Mr. Speaker. I read this petition that was submitted to me by Dr. Abraham Yoon of Richmond University Vision Care. Petition to save eye care in Ontario. To the Legislative Assembly of Ontario, whereas the Ontario government has underfunded optometric eye care for 30 years, and whereas the government only pays an average of $44.65 for an OHIP-insured visit, the lowest rate in Canada, and whereas optometrists are being forced to pay substantially out of their pocket to provide over 4 million services each year to Ontarians under OHIP, and whereas optometrists have never been given a formal negotiation process with this government, And whereas the government's continued neglect resulted in 96% of Ontario optometrists voting to withdraw OHIP services beginning September 1st, 2021, we, the undersigned, petition the Legislative Assembly of Ontario as follows: to instruct the Ontario government to immediately commit to legally binding formal negotiations to ensure any future OHIP-insured optometry services are, at a minimum, funded at the cost of delivery. I fully support this petition. We'll sign it and pass it to Paige Alfie to take to the table.
Thank you, Speaker. This petition is from many citizens in Thunder Bay, petition to save eye care in Ontario. To the Legislative Assembly of Ontario. Whereas the Ontario government has underfunded optometric eye care for 30 years, and whereas the government only pays on average $44.65 for an OHIP-insured visit, the lowest rate in Canada, and whereas optometrists are being forced to pay substantially out of their own pocket to provide $4 million of services each year to Ontarians under OHIP, and whereas optometrists have never been given a formal negotiation process with the government, and whereas the government's continued neglect resulted in 96% of Ontario optometrists voting to withdraw OHIP services beginning September 1st, 2021, we, the undersigned, petition the Legislative Assembly of Ontario as follows: to instruct the Ontario government to immediately commit to legally binding formal negotiations to ensure any future OHIP-insured optometry services are at a minimum funded at the cost of delivery. We'll sign this petition and give it to Paige Ella to bring to the table.
Thank you. The member for Oshawa.
Thank you very much, Speaker. And I have a whole whack of petitions that I'd like to share today to save eye care in Ontario. To the Legislative Assembly of Ontario, whereas the Ontario government has underfunded optometric eye care for 30 years, and whereas the government only pays on average $44.65 for an OHIP-insured visit, the lowest rate in Canada, and whereas optometrists are being forced to pay substantially out of their own pocket to provide over 4 million services each year to Ontarians under OHIP, and whereas optometrists have never been given a formal negotiation process with the government, and whereas the government's continued neglect resulted in 96% of Ontario optometrists voting to withdraw OHIP services beginning September 1st, 2021, we, the undersigned, petition the Legislative Assembly of Ontario as follows: to instruct the Ontario government to immediately commit to legally binding formal negotiations to ensure any future OHIP-insured optometry services are, at a minimum, funded at the cost of delivery. Of course, I support this. I will affix my signature and send it to the table with Paige Joel. Thank you.
Thank you. Petitions. Member for University Rosedale.
Thank you so much. This is a petition to save eye care in Ontario. To the Legislative Assembly of Ontario, whereas the Ontario government has underfunded optometric eye care for 30 years, and whereas the government only pays an average of $44.65 for an OHIP-insured visit, the lowest rate in Canada, and whereas optometrists are being forced to pay substantially out of pocket to provide over 4 million services each year to Ontarians under OHIP, and whereas optometrists have never been given a formal negotiation process with the government, and whereas the government's continued neglect resulted in 96% of Ontario optometrists voting to withdraw OHIP services beginning September 1, 2021. We, the undersigned, petition the Legislative Assembly of Ontario as follows: to instruct the Ontario government to immediately commit to legally binding formal negotiations to ensure that any future OHIP-insured optometry services are, at a minimum, funded at the cost of delivery. I support this petition, be fixing my signature to it and giving it to Paige Clare.
Petitions. Member for Algonquin. Petitions. The member for Hamilton East Stony Creek.
Thank you, Speaker. This petition is from the good people of Wellington Halton Hills. To the Legislative Assembly of Ontario, whereas the Ontario government has underfunded eye care for 30 years, and whereas the government only pays on an average of $44.65 for an OHIP insured visit, the lowest rate in Canada, and whereas optometrists are being forced to pay substantially out of their own pocket to provide over 4 million services each year to Ontario under OHIP, and whereas optometrists have never been given a formal negotiation process with the government, and whereas the government continued to neglect resulted in 96% of Ontario optometrists voting to withdraw OHIP services beginning December 1st, 2021. We, the undersigned, the petition of the Legislative Assembly of Ontario as follows: to instruct the Ontario government to immediately commit to legally binding formal negotiations to ensure any future OHIP-insured optometry services are, at a minimum, funded at the cost of the delivery. I agree with this and will sign this petition.
Further petition. Member for Toronto Danforth.
Thank you, Speaker. Presenting a petition to save eye care in Ontario to the Legislative Assembly of Ontario, whereas the Ontario government has underfunded optometric eye care for 30 years, whereas the government only pays an average $44.65 for an OHIP-insured visit, the lowest rate in Canada, and whereas optometrists are being forced to pay substantially out of their own pocket to provide over 4 million services each year to Ontarians under OHIP, and whereas optometrists have never been given a formal negotiation process with the government, and whereas the government's continued neglect resulted in 96% of Ontario optometrists voting to withdraw OHIP services beginning September 1st, 2021, we, the undersigned, petition the Legislative Assembly of Ontario as follows: to instruct the Ontario government to immediately commit to legally binding formal negotiations to ensure any future OHIP-insured optometry services are, at a minimum, funded at the cost of delivery. I agree with this petition. I have signed it, and I will give it to Paige Athesha for submission.
Thank you. Member for Thunder Bay, Atikokan.
Thank you, Speaker. This petition is the petition to save eye care in Ontario to the Legislative Assembly of Ontario. Whereas the Ontario government has underfunded optometric eye care for 30 years, and whereas the government only pays on average $44.65 for an OHIP-insured visit, the lowest rate in Canada, and whereas optometrists are being forced to pay substantially out of their own pocket to provide over 4 million services each year to Ontarians under OHIP, and whereas optometrists have never been given a formal negotiation process with the government, and whereas the government's continued neglect resulted in 96% of Ontario optometrists voting to withdraw OHIP services beginning September 1st, 2021, we, the undersigned, petition the Legislative Assembly of Ontario as follows: to instruct the Ontario government to immediately commit to legally binding formal negotiations to ensure any future OHIP-insured optometry services are at a minimum funded at the cost of delivery. I support this petition, will add my signature and send it with Paige Isabella to the table. Thank you.
Petitions, the member for Windsor-Tecumseh.
Good afternoon, Speaker. Yes, I'd like to add another 300 names or so on a petition to save eye care in Ontario. To the Legislative Assembly of Ontario. Whereas the Ontario government has underfunded optometric eye care for 30 years, and whereas the government only pays on average $44.65 for an OHIP insured visit, the lowest rate in Canada, and whereas the optometrists are being forced to pay substantially out of their own pocket to provide over 4 million services each year to Ontarians under OHIP, and whereas optometrists have never been given a formal negotiation process with the government, and whereas the government's continued neglect resulted in 96% of Ontario optometrists voting to withdraw OHIP services beginning on the 1st of September this year, we, the undersigned, petition the Legislative Assembly of Ontario as follows: to instruct the Ontario government to immediately commit to legally binding formal negotiations to ensure any future OHIP-insured optometry services are, at a minimum, funded at the cost of delivery. I fully agree, Speaker. I'll be signing it, and it'll find its way down to the desk.